Welcome to Tudor Hair Clinic. Today I'm going to take you through the full process of our Exosome Hair Rejuvenation treatment. This is a non-surgical treatment for hair loss. In this video you'll see the full treatment from start to finish. I have had to speed up some of these videos, otherwise it would have been an hour and a half watch, so I've condensed that hour and a half into just 12 minutes. Not everyone with hair loss realises that there are non-surgical treatments out there that actually work, but most of the time people leave their hair loss for so long that it's too late and the only answer is a hair transplant. But even if you get to the hair transplant stage, having an exosome rejuvenation treatment can actually thicken and strengthen the density of your hair, so you've got more hair to take from the donor site. So let's get into it. The room and everything I am using, including the couch, have all been wiped down with the Clinell antibacterial wipes, so the room is ready and prepped for my client. The couch is covered with a disposable cover and a headband is placed on the client so no products or anything run into their eyes. I also use a neck pillow for comfort, but also to tilt the head back so I can get to the treatment area a lot easier. Now my client is all ready for treatment. The scalp is thoroughly cleansed with a chlorhexidine spray, and it even feels like having a nice little head massage. During this treatment we will be breaking the skin barrier, so the cleansing and the cleaning and all the protective gloves and covers are very important whenever you have any treatment like this done. If you're going into a setting to have any kind of treatment that breaks the skin barrier, you want to make sure the setting is very clinical and very clean. So the first part of this treatment is to put numbing cream on the scalp. Now a lot of people think that you can have no numbing cream with microneedling, and that's absolutely fine. But when you're microneedling on the scalp, it can be very painful because there's not a lot of fat tissue underneath the skin, so it kind of bounces back when the needles are pushing into the skin, and you can feel it more. Now everyone does have a different pain threshold, but numbing cream just makes it a lot more comfortable, it makes it pain free, and it's a lot more enjoyable experience. Now I always decant my numbing cream, I never just take it straight out of the container, I always decant it so there's no cross-contamination. Even when I'm rubbing the numbing cream in with my hands, I put alcohol hand sanitizer on my gloves before I did this. Once I've covered the entire treatment area in the numbing cream, I will cover it over with some cling film. This helps to make the numbing cream work more effectively. It is left on for 25 minutes. During this time, the helmet is worn. Now this is an LLLT helmet, so that's low level laser therapy. Low level laser therapy is a non-invasive treatment that uses gentle red light energy to support healthier, stronger hair growth. It is completely painless and works by delivering a specific wavelength of light into the scalp. This is where it can be absorbed by the hair follicle cells. When the laser light reaches the follicle, it boosts cellular energy by increasing ATP, which is the fuel source that hair-growing cells rely on. Higher energy levels allow the follicle to repair itself more effectively and return to producing thicker, stronger hair. This process helps move more hair follicles out of the resting phase and back into the active growth phase, supporting a fuller and healthier hair cycle. LLLT also encourages better microcirculation in the scalp. As blood flow increases, the follicles receive more oxygen, nutrients, and growth-supporting signals. This is important because one of the main reasons of hair loss is reduced circulation. In addition, the light has an anti-inflammatory effect, helping create a calmer, healthier environment around the follicle so it can function normally. Another valuable effect of LLLT is its stimulation of the stem cell bulge, the part of the hair follicle responsible for regenerating new hairs. When this area is activated, it sends signals that encourage the follicle to produce stronger strands and stay in the growth phase for longer. This is a key reason why LLLT can improve both density and overall hair quality over time. So once the light therapy has completed and the numbing cream has taken effect, all of the numbing cream is then removed with a chlorhexidine spray. It is important to make sure that all of the numbing cream is removed before we go on to the next phase, which is microneedling. So in this procedure of microneedling, I'm using an 11-pin cartridge. As I perform the treatment, I'm combing sections of the hair to get a complete neat line of the scalp to make sure I'm actually hitting the scalp and not just going over clumps of hair. So I separate each section and then I use dabbing motions, circular motions and linear motions to make sure I've really covered the treatment area. And in between each of these sections, I will be applying topical exosomes, polynucleotides and peptides, all discussed at consultation. So microneedling for hair loss is a highly effective, minimally invasive treatment that works by creating tiny, controlled micro-injuries on the surface of the scalp. These microchannels are created using a device with very fine needles that gently puncture the skin at a precise depth. Although the injuries are microscopic, they trigger a powerful healing response within the scalp. The body immediately recognizes these small punctures and sends growth signals, nutrients, and repair cells to the area. This is a natural healing process, and it increases collagen production, boosts blood flow, and awakens dormant or weakened hair follicles, helping them transition back into an active growth phase. One of the most important effects of microneedling is its ability to stimulate the stem cell bulge within the hair follicle. This bulge region is responsible for regenerating new hair, and activating it is key to reversing the miniaturization process seen in androgenetic alopecia, or male or female pattern hair loss. When the stem cell bulge is triggered through microneedling, it sends biochemical signals that encourage the follicle to produce thicker, healthier strands and remain in the growth phase for much longer. Over time, this can help reverse thinning, increase density, and improve the overall quality and strength of the hair. Microneedling also enhances blood circulation in the scalp. As the skin begins its repair cycle, blood vessels dilate and bring increased oxygen, nutrients, and growth factors to the follicle. Many people with hair loss experience a gradual reduction in blood flow around the follicle, which accelerates the miniaturization and thinning. By restoring circulation, microneedling helps nourish the follicle more effectively and supports healthier, more robust hair growth. This improved nutrient delivery is one of the reasons clients often notice thicker, stronger strands in the months following consistent treatment. Another major benefit of microneedling is that it greatly improves the absorption of topical treatments such as peptides, growth factors, and exosomes. The microchannels created in the skin allow for these active ingredients to penetrate deeper and reach the follicle more effectively. So let's talk exosomes, the gold standard of hair loss treatments. Exosomes are tiny, naturally occurring communication vessels released by stem cells. They act like messengers, carrying growth factors, proteins, and genetic signals that tell other cells how to behave. In hair restoration, exosomes are used because they contain a concentrated blend of regenerative signals that encourage healing, reduce inflammation, and stimulate the activity of hair follicles. Unlike stem cells themselves, exosomes do not replicate. Instead, they deliver precise instructions that help the scalp enter a healthier, more active state for hair growth. In this treatment, I am applying billions of exosomes to the scalp, and because of those microchannels, the exosomes immediately begin communicating with the weakened or dormant follicles. They deliver signals that promote cellular repair, enhance blood supply, and shift follicles back into the growth phase, also called the anagen phase. They also carry anti-inflammatory molecules that calm irritation around the follicles, which is a common contributor to thinning hair. By improving the scalp environment and activating the biological pathways responsible for hair growth, exosomes provide a powerful stimulus that helps revive compromised follicles. Because exosomes work on a cellular level, their effects are natural, gradual, and long-lasting, making them an advanced and highly effective treatment option for hair restoration. Near the end of the treatment, you will see that the scalp has a nice even redness called erythema, and you may have occasional blood spotting, which is absolutely normal. Then with a disposable spatula, I apply some Aquaphor ointment to the skin. This acts like a skin barrier and it will protect the skin and allow the skin to heal. I will then give the client their aftercare instructions and book their next treatment in 4 weeks later. A course of 6 treatments is recommended, with the hair growth really starting to show around 4 to 6 months and the full result at 12 months. Now you know everything that's involved in an exosome hair rejuvenation treatment and that there are non-surgical options out there to help you on your hair loss journey.